Hello and welcome to Health Show with Amara from our London studios. As you know, in this show we talk about health and health related matters that are not only important for public but also for those who deal with these problems on day-to-day basis. Obesity, a global challenge, we can call it an epidemic or a pandemic, and according to the world consensus, in United States more than 40% population suffers from obesity, and the problem became so huge that in 2013 American Medical Association voted to consider obesity a disease, and the idea of doing that was to help treat it and also to take the preventive measures, and a lot of other societies welcome that, and therefore today we call obesity a disease. In order to understand why obesity is a disease, we have invited today a renowned surgeon from Midlands, Mr. Amir Khan, who is not only a surgeon with decades of experience in this particular field, but he's also a trainer in Pakistan as well as member of Pakistan Society of Bariatric and Metabolic Surgery. In addition to his surgical roles, he's also president of Association of Pakistani Physicians and Surgeons of Northern Europe, which is the largest democratic organization of all the doctors in UK and Europe. Let's welcome Mr. Amir Khan. Welcome, Mr. Khan. We would like your views on on obesity as a disease, for people to understand why we consider it as a disease, because some people, they take it as a stigma, and that prevents them from coming forward to seek help. So what would you tell us viewers?
It's very important, Amara. Thank you very much first giving me an opportunity to come and talk to the viewers about this huge medical problem, and that's obesity. As you mentioned earlier, it is an epidemic, to be honest with you. We got so many people now who are obese, and the reason we call it as a disease is because it's not just because of the physical structure of a body, it is metabolic effects. Obesity leads to lots of metabolic problems. There is a syndrome called a metabolic syndrome, and that comprises of people who either hypertension, high cholesterol, or diabetes. And these are the people who come into that category. And then there are other diseases, like if you see arthritis, so many people have got problem with the hips and knees because the weight they're carrying is not meant for it. Those joints are not meant for that. Similarly, people find physical as well as medical problems which are making life very difficult for them. At present, NHS, which is a national service in UK, we are spending huge amount of money treating diseases which are related to obesity. And that's one of the reasons why National Institute of Clinical Excellence recognized it as a disease and recommended a treatment for it, because the treatment for obesity actually saves a lot of expense later on.
And I mean, we all are aware that we see more people who are obese in UK when it was recognized as a major problem in US until it was recognized as a disease. So what do you think, what has led to this increase in UK?
Amara, I see that overweight, call it overweight or call it obesity, whichever way you want to. Normally what happens, the UK is about 5 to 10 years behind US. And it's a junk food and it's a lifestyle, because people are eating more of this fast food but are not exercising. And that is what has led to overweight. Because you see, each of us have got different requirement, metabolic requirement or different requirement of food to what we consume. Because it might be, I might eat more than you do, but our requirements are different. So someone can put weight on. You know, a lot of people you come across, you say, well, I don't eat, but I put weight on. I tell them, it isn't what you eat is more than what others do, but it is what your body needs. You are putting more in it than what you are consuming. And that is the reason why people put weight on.
And do you see there are any differences in the gender, race, or age? Because as a gynecologist, I see a lot of young girls, they present with hormonal disturbances in a condition called polycystic ovarian syndrome. So I'm sure you have come across these young girls with major problems, and it's not just the physical issues, there are psychological dilemmas attached with it. So how do you deal when you see these young people in your clinics with major problems?
Yeah, I think I'm glad you reminded me and touched a very important topic, because I've been arguing with gynecologists for years down the line, because I believe PCOS, which is a polycystic ovarian syndrome, itself does not cause obesity. It's obesity which causes PCOS. Because I have seen women, young girls who've come to us because of metabolic disturbance. A lot of them are having difficulty in conceiving or having getting pregnant, having children. When they come to us, they have surgery, they lose weight. Once they've lost weight, they, in a natural way, can conceive and have normal life. And the syndrome, the effects of the metabolic syndrome of PCOS actually disappear once they lose weight. Weight has got a big element to it. And that is one of the discussions we normally have with our gynecological colleagues like you.
Yeah, I agree, because a lot of young girls, when they have the diagnosis of polycystic ovaries or a syndrome, they think that the obesity is not their fault. It's not because they are eating more or their lifestyle is not great. They think it is, they are unfortunately born to be obese. And what do you say to them? How do they improve their lifestyle in order to stay fit?
Yeah. I think it's again a myth here that people are born to be obese, right? The reason actually it happens, it's more environmental effect, because if you see, for young girls, their role model is their mom, right? And it's the type of food and type of habit everyone else has in the family itself. So they look at them and they think it's normal. That type of activities they do very little. Remote has got a big role to play in that, because we sit in front of the TV and use remote, don't even get up to come and change the channels. So I think it is more an environmental thing, and the way you've been brought up, that's why it runs in the family. You know, there's a joke about it. The doctor, obesity runs in my family. I usually say it's not the obesity runs in the family, no one in your family runs. And I think that's where the problem is, that people are not consuming energy or the calories which they are eating.
Yeah, I agree with you on that. And also we witness that young girls are more worried about their reproductive status, because they think that because of the PCOS they may not be able to have children. But we know that obesity is also one of the major causes of rise in the cancers, mainly in women, breast cancer. It is, we are seeing that it is escalating, and one of the causes is considered to be obesity. What is your view on that?
Perfectly right, because if you look statistically, all cancers are increased in people who are overweight. There is also a strong evidence now that there is the life expectancy is reduced when people are overweight. And there's a reason for that, because I think they carry a lot of metabolic problems. They're diabetic, they're got arthritis, they're not moving around, they're hypertensive, they get cardiac problems, they increase cholesterol in their body. This is all related with our eating habits and our exercise. So I think this is a simple formula which works out what you put in your body. If you burn less than that, the rest is going to be stored, and that will be in the form of weight. And if you burn more than what you eat, then you are not going to put weight on. So you have to find a happy medium, which is right for you. And that's why it is very different for every individual. And this was the main, lot of statistical work was done on it. And economists came to the conclusion that the treatment we give to people to lose weight actually recovers within 2 years of their treatment. Because the number of medications they're on or number of problems they're suffering, you reduce them, and that's how you save money for the health economy. And that's why the treatment for obesity is available on National Health Service in UK.
Thank you. And with this increase in the health related issues in people with obesity, when it requires surgery, I'm sure as a surgeon you come across a lot of difficulties operating on these people. So, would you share your experiences when you're operating on people with obesity?
Yeah, I think early stages when I started in my career, it used to be open surgery. We used to cut it and then go in. It was really very difficult in people who are overweight because of access. Physically, it was difficult. But now with laparoscopic surgery, it's become much easier because it's all done as a keyhole surgery. So the results are better, there are less complications. But yes, it is a challenging operation. But most of the people who are doing it, they're well trained and results are fairly good. And what I'll do, I think it might be helpful to your viewers if I go through different treatment modalities and help them to understand that. There are very simple ways. I tell my patients the first thing is dieting. If you watch your diet, reduce your carbohydrates, you can increase proteins, you can increase vegetable, increase your exercise so you burn more. Chances are you should be able to lose weight. If you cannot do with that, then there are different treatment options. There are medicines available. There are medicines which increases your or reduces the amount of fat you absorb. You can take those tablets, oral stat. Then you got injections like Ozempic. What they do is they actually reduce your appetite, right? And that's how you lose weight with it. It was originally devised for treatment of diabetes. Then we move on to very simple option, which is non-interventional, and that's called an intragastric balloon. What the balloon does, it fills up your stomach, right? And what I'll show you actually, I've got one lying here in front of me, because it's like a capsule like this, right? What you do is you swallow this capsule, and once it's in your stomach, we check with an X-ray, and what we do is we fill it up with the fluid, and it becomes like this. Right? And that's about, it's about 550 mils. That's equivalent to a pint. And after 4 months, the fluid comes out and it becomes like this polythene paper. And that then passes in your normal bowel action. So this is a totally non-interventional. So that is the first way of helping to lose weight. And this is very useful for those people who need to lose a couple of stones. But those who are morbidly obese, now it's a term morbid, people get worried about it. The reason we call morbid obesity is that people have started developing metabolic problems because of obesity. Like someone who's already become diabetic or someone who's already hypertensive, we call them as morbid obesities, right? Morbid obesity is defined as, because we do a body mass index. What you do is you take your weight, you take your height, you divide the weight by height times square, and that gives you BMI. A normal person's body mass index should be about near 25. Once it goes to 27, 28, we call them overweight. Once it crosses 30, we call it obese. Then once it crosses 35, for a European population, they start becoming into a category of morbid obesity. But for Asians, at 32 BMI, they become called at morbid obesities, that they become morbid obese because our structure is such. So the levels changes. So those groups are the ones which go for surgical options. Then there are lots of surgical operations. The operations are mainly devised for two ways they help. One is by reducing what you eat, and secondly, by reducing the absorption of food what you eat, right? So that's why like there is an operation like a band or sleeve, or then there are operation which causes both restriction as well as stop you from absorbing, and then that's a bypass. Then there are different type of bypasses. So I think for people to understand that the surgical treatment is very safe, but it is a last resort. It's not a first resort. The first thing is changing the lifestyle, right? Changing your habits, changing your eating habit as well as increasing exercise. Once you've done that, then surgery can help you in order to take you to the next stage. But it is mostly reserved for those people who are morbidly obese. I'll give you a very starking statistics. In Pakistan at present, 30% of our population has got a high blood sugar. And that is because of weight problem, a lifestyle. We are all fond of roti. And we eat roti or we eat rice. They're both carbohydrates. So I think one need to control carbohydrates, reduce the carbohydrate intake, and increase your proteins or vegetables. And exercise is vitally important. So I always tell patients when they come to me that, look, guys, the first stage is changing your lifestyle. Then come other interventions. Because without lifestyle change, the interventions are not going to work. So I think that's where people need to understand that.
Yeah, that's great information. So I just want, I'm curious to know the injections you mentioned, are they available on NHS?
Yes, they are. They are available on NHS as well as they're available in private sector. Same, they're also available in Pakistan, right, around the world. There's been a shortage recently because originally they were mainly brought out for treatment of diabetes. But now because they've been approved by FDA for weight loss surgery, there's a bit of high demand for them. But they are very useful for people when they want to lose between about, I would say, 10 to 15 to 20 kilograms. They're very useful for them.
Oh, that's good to know. And also, I mean, I'm just curious to know, and I'm sure viewers would also want to know that there must be some eligibility criteria for referral for injections as well as the bariatric surgery. Is there any particular information you would want to share with our viewers?
National Institute of Clinical Excellence has actually done, because they do analysis by looking at cost versus advantages, right? And they balance them out. And what they say is that when people have crossed, like becoming more morbid obese, or people who've got metabolic problems, along with their weight, they are eligible to be treated on NHS, right? For someone to be treated like for European population, we class it a body mass index of 40 or above, or body mass index of 35 with comorbidities. And the comorbidities, as I mentioned, was diabetes, hypertension, hypercholesterolemia, PCOS, intracranial hypertension. These are the areas where we allow people to have this type of surgery. For Asian population, the BMI is lowered. We call it at 32 with comorbidities and at 35 without comorbidities. It's very interesting. At present, there are trials going on in India where they are looking at normal weight people who are type 2 diabetic to see if they have a bypass and what sort of result they get. So we are impatiently waiting for the results, because there is something to do with it that if you can bypass the pylorus and the duodenum, which is the later part of after the stomach where the food goes in, you can, so somehow insulin behaves very differently. So I think that trial, we are waiting for it. But at present, anyone who is of Asian origin, BMI of 32 and above, are eligible for bariatric surgery.
So I don't know, I was just thinking that would Asians take it as a privilege and then they would say, oh, I can eat as much as I want because I've got the privilege that I can be referred for these treatments that are available, more available to them because of the increased risks due to obesity. So have you seen that, this kind of thoughts amongst Asian population?
No, Amara, that's why I mentioned earlier that as far as unless until you change lifestyle, nothing works. Human body is brilliant. I tell you, I give example to my patient that when we operate on people with cancer of the stomach, we remove the stomach. But they do put weight on because we tell them to eat 10 times a day, basically, a small amount 10 times a day. So if you do not change your lifestyle, it's a waste of time. In NHS, one of the criteria is that you have to go through a weight management program for at least a year before you before you are eligible for surgical intervention.
Yeah, so it's
So
not
my
a
medical
privilege. They
colleagues
have to
will.
work very hard before
Yes.
they come for
Yes.
any such sort of treatment. So this was great information, and I'm sure our viewers would love to hear more. And thank you very much from our studio. We thank you for your time, and we hope that we can have you again for further sessions with regards to health-related issues. Thank you very much.
Inshallah. Thank you very much, Amara. Thanks for your time, and thanks to QTV, please. Thanks.
Dear viewers, you would agree with me that we had an excellent, a very enlightening conversation with Mr. Khan about this global problem, the obesity. Not only that we know a lot about how this disease is treated, but also how to prevent it, mainly by lifestyle adjustments. Thank you very much for listening. Next week, we'll bring more experts with more important topics. Until then, goodbye.